I'm Christina Sheridan, the Principal Investigator for the healthAction Patient Toolkit. In a population of 315 million people, there are 100 million chronic patients today in the US. And of that 100 million, between 30 and 50% have multiple chronic conditions. In addition to these patients, there are between 34 and 52 million caregivers for these patients. These patients can bring significant value to their care team. They're not only recipients of care, but if we enable them to be participants, they can add value with regard to symptom information and medication information in particular. For example, when a patient walks into a provider's office today and a provider asks them how they're feeling, they will tend to provide a short list of symptoms, those that are most significantly impacting them. But chronic patients often have 10, 15, 20 symptoms, and for a patient to remember that from memory or handwritten notes is very difficult. In addition, these symptoms are provided in just a snapshot format. If we can instead enable that patient to capture this data longitudinally and capture the severity of all their symptoms every week, now when they go into their doctor's office, instead of providing that snapshot of incomplete symptom data, they could provide a complete list of information, and the provider can see the trend and how those symptoms have fluctuated since their last appointment or since they started the last medication. This information can help significantly in both diagnosis and also evaluating treatment plans. Another piece of missing patient-generated data today is treatment compliance data. When a provider gives a new medication and follows up to find out how that medication has been effective, they don't always know how often the patient took the medication, or if, for example, they've been skipping their morning dose because it makes them feel nauseous. If we can capture that information again, and the patient themselves can keep a record of which medications they've taken, it again changes the conversation in the appointment to be around, instead of, your symptoms have not improved based on the medication changes we made, the conversation now becomes, I see you've been skipping your morning dose and it looks like it's making you feel nauseous. Let's talk about that. So this information is very important, valuable information that adds value both to the provider for diagnosis and for treatment, and also to the patients themselves. If the patients can see that their symptoms are increasing over time, they can then have the option to bring an appointment forward or call a provider ahead of time and not wait for a scheduled appointment, and maybe identify a comorbid condition earlier. So if this information is so critical, why is it so hard for chronic patients to provide it? Most people fill their complete day with going to work or enjoying their family and friends. Chronic patients and their caregivers, however, in addition to doing these two things, have to manage complex medications, understand which medication to take when, and if they skip a dose, whether it's okay to take it later or not. They have to assemble and operate medical devices that they're not trained to use. They have to research their conditions, they have to set up appointments, tests, they have to manage their symptoms, and that doesn't even include the bills. There are many health applications today, but some of them are not easy to use. Some of them do not present the information in a way that can be fully leveraged, and most of them do not fit well into the day of a chronic patient. If you have a patient who's already overwhelmed with the amount of things they have to do during the day, it's critical to design the application to fit into the workflow of their day and help them manage the illness while also collecting the information. The Patient Toolkit has been designed to be easy, to effectively present the information in a way that can be used quickly, and also to integrate fully into the patient's day. We wanted something that would be habit forming, something that the patients themselves would want to pick up first thing in the morning and keep with them all day. If we were to do that, we would be able to collect this information on a regular basis, and it would be available for the providers when they saw them. In addition, we need to be able to prepare the patients before they walk into their appointments. So we provided a checklist capability within the toolkit that will walk them through the preparation for the appointment. So they don't have to remember, they're prompted with questions, they're asked about what they want for the goals for their appointment. And in addition to that, the toolkit will automatically pull in the data it's been collecting and present it to the provider in a way that they want to see it. In addition to developing the toolkit, the research team have been collaborating with the University of Virginia on a clinical trial to evaluate the effectiveness of patient-generated data, in particular, longitudinal severity symptom data. This trial will help validate the reliability of this data and how it can be applied and used by providers and patients. In addition, the team's been collaborating with the Carnegie Mellon students to evaluate the impact and the value of lifestyle data. This research will enable patients to be active contributors with their care team. It'll collect this missing data, present it in a way that can be leveraged, and prepare the patient for when they walk into their appointments to fully partner with their care team.